Pregnancy that ends spontaneously before 24 weeks of gestation is known as miscarriage. These are the risk factors of miscarriage. Number 1 is chromosomal abnormality. Number 2 is medical disorder. Number 3 is any endocrine disorder. Number 4 is uterine abnormality. Number 5 is infections. And number 6 is drugs and chemicals. तो फर्स्ट 3 जो है वो फीटल रिस्क फैक्टर्स हैं मिसकैरेज और नेक्स्ट 3 मैटरनल फैक्टर्स हैं। यहाँ मैंने टाइप्स ऑफ मिसकैरेज को बहुत सिंपल वे में समराइज़ कर दिया है। सो हमारे पास फर्स्ट टाइप जो है वो है थ्रेटन मिसकैरेज। इसमें हम अल्ट्रासाउंड स्कैन फाइंडिंग्स में इंटरयूट्राइन प्रेगनेंसी मिलती है विद अ फीटल हार्ट रेट प्रेजेंट। क्लिनिकल प्रेजेंटेशन आ जाती है इसकी, वेजिनल ब्लीडिंग है, एब्डोमिनल पेन है, ऑन एग्जामिनेशन सर्वाइकल लॉस इज क्लोज्ड। Next is inevitable miscarriage. Ultrasound findings include no intrauterine pregnancy, there is no fetal heart sound present. Clinical presentation include vaginal bleeding, abdominal pain, and on cervical os examination, the cervical os is open. मैनेजमेंट में एक्सपेक्टेड मैनेजमेंट करेंगे, देन मेडिकल मैनेजमेंट करेंगे, देन सर्जिकल मैनेजमेंट करेंगे। नेक्स्ट इज इनकम्प्लीट मिसकैरेज. The ultrasound findings show the retained products of conception. Clinical presentation include vaginal bleeding and abdominal pain. On cervical examination, the cervical os is open. Products of conception are located in cervical os. Management include removal of pregnancy tissue at the time of speculum examination. Next is complete miscarriage. The ultrasound findings show empty uterus and need beta HCG to exclude the ectopic pregnancy. Pain and bleeding has resolved in case of clinical presentation, and on speculum examination the cervical os is closed. Management is only supportive in this case. The next is missed miscarriage. The ultrasound findings include intrauterine pregnancy but no fetal heart sound is present. The cervical os is closed in this case. It is asymptomatic and often diagnosed at booking ultrasound. There is no history of bleeding and dead fetus or embryo before 24 weeks of gestation. Thus, the size of uterus is small as compared to the pregnancy. The management is expectant, medical and surgical. Next, the common investigations include CBC and RH, urine analysis, cervicovaginal swab, and pelvic ultrasound. And the evaluation include abdominopelvic examination, transvaginal ultrasonography, transabdominal ultrasonography, and the HB levels. Medical management includes the administration of single repeated vaginal or sublingual dose of prostaglandin E analog, misoprostol. And the surgical management include dilation and evacuation. Next, an important MCQ comes that what is the most common sign of miscarriage? So this will be vaginal bleeding. Here the common management of spontaneous miscarriage is summarized. Whenever the questions comes that write down the management of miscarriage or write down the management of spontaneous miscarriage, so you will write the answer like this: initially hospital admission and resuscitation, then IV line access and administer the fluids, the baseline investigations, and take the blood for cross matching, and the fourth one is analgesics. Definite management include misoprostol. So this was all about miscarriage. Do not forget to like and subscribe my YouTube channel.